Okay, let's look at the effects of traction real quick. First thing we got is joint distraction. So the traction forces can be used to separate the articular surfaces or the facets, and this can cause a reduction in spinal nerve compression and increase form and size. Now, as we first start distracting, we're actually going to distract the soft tissue first, the muscles, the ligaments, and the tendons. With enough pressure increase, we start having facet joint distraction. And that force required is dependent on the size of the facet joint and the health of the joint. So, for example, if we're going to distract lumbar facets, it's going to be 26 to 50% of body weight, whereas on a cervical spine facet, it will be a much lower number, like 7%. Also, joint mobilization. So we're talking about a gentle stretch for muscles and tendons around a joint. And we actually get a gating effect if we're doing intermittent pull and relax times. We let those mechanical receptors activate the inhibitory interneurons at the spinal cord. This reduces pain signals that make it to the thalamus. Okay? Now, physical therapists have manual mobilization in their scope of practice where they can focus on specific joint mobility, like at specific joints using techniques. But for a PTA, we're probably going to be doing modality mobilization, which is harder to control the specificity of the exact position that we're going to put the traction forces. So many joints will be mobilized at once. And later, we'll see with positioning how we can kind of focus that force. Another effect is protrusion reduction. So the theory is with these traction forces, we can pull the vertebra apart, and that creates a vacuum in the disc. Intradisc pressure it becomes negative, and the idea is that it will pull that protrusion back to the center, which can then normalize body mechanics and reduce pressure on the spinal nerves that are leaving the intervertebral foramen. Okay, that's the basic idea of protrusion reduction. We can also just do soft tissue stretching, and this is going to be a small force, less than 25% of the body weight. And a good example of what we would actually be affecting first are the smallest back muscles and extensor muscles. So we have the semispinalis, which are deep muscles in the back that originate at the transverse processes C4 to T10. And they insert on the spinous C2 to T4, as well as the occipital bone. And when they fire bilaterally, they can extend. If they're unilateral, they can rotate the head. We have the multifidus, which originates in the sacrum, PSIS, and transverse processes of the thoracic, and the dorsal mammillary processes of the lumbar. These are most developed in the lumbar area, but they are present all the way to the superior cervical spine, I think the axis. They insert into the base of the spinous processes 2 to 4 levels above origin. And then we have the rotatores, or the rotator muscles. These are situated on the sides of the spine, and they help enable unilateral rotation, turning from side to side. Firing together, they can perform bilateral extension, or extension if they fire bilaterally. There are short and long spans that span 1 or 2 vertebra, and as I said before, they're deep. And these are very proprioceptive due to high levels of muscle spindles present. And then muscle relaxation. So with static traction, we can attempt to reduce the reflex arc. So we're trying to reduce monosynaptic reflex arc, which are sensory nerves that are being turned into motor movement at the spinal cord without involvement of the brain or the central nervous system. By breaking this cycle, we can get the motor movement and the motor firing to go away, which can then reduce irritation and pain and breaks this cycle. As far as intermittent traction goes, we have the gating effect by pulling and releasing and pulling and releasing, reducing pain signals and guarding from the central nervous system. The gating is intermittent traction can cause gating via mechanical receptors at the spinal cord, activating inhibitory interneurons. and we can inhibit alpha motor neuron firing with the Golgi tendon organ.